Hey, welcome everybody. Season 1, episode 25, Joe's Hot Takes 25. Why 25? Because we do 25 episodes per year. And you can see I've got somebody sitting next to me. This is my daughter. This is Cherie. And we're going to jump into this. This is definitely going to be a hot take, right? This is going to be a hot take today. So here's the deal, right? I like to do these podcasts. I like to ask some questions about topics or hot takes for the day, sprinkle in a little research and facts, discuss them, provoke thoughts. I want you to have the fuel and the information to make a good decision about the topic. And the topic today hits really close to home because Cherie's been dealing with it and going through it, and it's not been pleasant. But we're talking about healthcare in America. Again, not doing this alone. So the guest today is Cherie, and she's going to be jumping in as we move along. And wow, welcome.
Thank you. It's an honor to be here with my dad. Thank you.
How fun.
Not under these circumstances. But
no,
hey.
Well, hey, we'll get through it, right? Okay. So let me give you a little quick background. Cherie's going through this medical and insurance, a nightmare. It's been going on. I'm going to let her fill it in, and she's going to tell her story here in just a minute. But she's been going through this with United Healthcare. She pays for insurance, probably a lot.
A lot. Over $6,000 for my max out-of-pocket deductible.
Okay.
Which I've hit a long time ago.
So you got to, yeah, not only is she paying a monthly, but now she's got to go, oh, I'm going to need some major medical. So I'm going to have to spend all of this $6,000 before they're even going to talk to me about covering anything. So I don't know how about you, but $6,000 coming out of my pocket right now would definitely make a dent. It would definitely hurt. So, hey, listen, let's do this. Let's unpack this problem and let's talk about it. So one thing I did, as you know, I like to do a little research, but I thought let's do some really basic, simple research. So all I did is I just asked Google, why is healthcare so expensive in America? And this is what we found. That the U.S. healthcare costs are high because of higher prices for services. More costs for the drugs, the medical equipment. It's driven by hospital and provider consolidation. So the hospitals and the providers are the ones that are pulling all the strings here, deciding how much things are going to cost. There's a lack of price regulation because the government in the U.S. is not regulating a lot of the medical procedures. They're not regulating a lot of the medications and things like that. So they can charge whatever they want. And surprisingly, coming up here in a few months, I'll have another podcast I'm working on and researching. But I can tell you that 2024 numbers for profits for the top three healthcare providers are in the billions. That's their profits. It's in the billions, guys. So we definitely need to talk about it. Yeah, so this is hugely a profit-driven market, and that's it. How do we end up, right? We're America. How do we end up spending more than any other wealthy nation and still not always get the best results? That's a good question. Let's break it down a little bit. Let's talk about hospitals, doctors, and pharmaceutical companies in the U.S. I'm looking at my notes here. They charge more for services. The drugs, the equipment, all these things that other wealthy countries have, they don't charge as much. And we're going to talk about it a little bit more. Like if you've been to the hospital or you've had any kind of procedures where maybe you had to stay all day or overnight, and you look at those bills and you realize how much they're charging for things like a box of Kleenex or those little plastic urine collectors. It's ridiculous, guys. It's ridiculous. Unlike other nations, the U.S. doesn't regulate or cap prices. I found that out. So pretty much price rises, those are unchecked. They just do it. Consolidation. When hospitals and providers merge, which we see that all the time, That reduces competition, and what happens when you get less competition? You get higher prices, right? So I did talk about exactly this when I talked about the defense spending in America, right? Because they did the exact same thing with defense. They consolidated all of the defense contractors. Instead of having 50 some contractors, they consolidated them down to 5. Now there's 5 contractors. Well, the same thing's happening in healthcare. When you consolidate these hospitals and now you funnel in specialty physicians. So you have physicians that only do certain types of procedures and they're in these particular hospitals. Guess what? Dollar signs, big ones. That's what's attached. So I'm going a little quick because I want to give Cherie a lot of time because I want her to talk about all of this stuff that she's had to deal with. But our system is fragmented and it is complicated, and with endless billing and payment processes, right? I don't know if any of you have tried to reach out to your healthcare providers in certain situations. It's just like this revolving door, right? You leave a message, call back, leave a message, call back. You can't get through to people. And in some of these companies, you can't even get to a human. You have to fight your way through, a whole plethora of push this button, push that button if you want this. And you have to listen to these endless droning on conversations from a computer telling you, well, the easiest thing to do is just go to the website. Well, yeah, website can't fix it.
Just read a great article and it's called sludge because that's literally what these companies put us through is the sludge. So we're digging our way out.
We're digging our way out of the sludge. Mm-hmm. Yeah, I love it. Hey man, come on. Profits, it's all about it. Healthcare organizations are profit driven. So don't think that they're not. Don't think that even if they say they're not for profit, they still need to make money. They still need to pay their administrators, their physicians and everybody. And they pay them extremely well, much higher than any other place in the country or in the world. One thing I can say about us here in the U.S., we are quick to adopt new technologies and procedures. So if something new and exciting comes along and it looks like it's going to work, we're jumping on it. But guess what? Comes at a cost. Anything new, anything cutting edge, you're going to pay a lot more for it. Think about the iPhone when iPhones came out, right? They were so expensive and everybody's like, oh my God, these things are so expensive. And now we're on what, iPhone 16 or something, or 17? I don't even know where we're at. But you can go to your wireless provider now, sign a year contract, and get a free phone. It's not like it was. So the same thing with healthcare. These new procedures come along, and they wallop you until it becomes not a new procedure. So, and the biggest problem I think that we all have, and I'm sure Cherie can agree with this, because Cherie is also a health coach and she understands nutrition and how to be active and take care of your body. But here's the thing, we are not a healthcare driven society. We are a sick care driven society. And that is also a problem. And it's really, there's less emphasis on prevention and more emphasis on treatment, right? Quick example for myself. A couple years ago, I had my blood test done, my annual physical, the one time a year that I go to the doctor. And I get a phone call, and I've already seen my results because they're posted online. So it's easy for me to go look at them through the lab. So I look at my results. I do a little research on it, and I'm like, yeah, I'm good. This one's getting a little high, but this one's really, really good, and I think I'm good. Boom, the next morning I get a phone call. Yeah, this is your doctor's office. Oh, hi, doctor's office. Yeah, we noticed that your bad cholesterol is slightly high. It's getting close to the highest level, so we're going to go ahead and start you on some medication. That is a quote, end quote. We are going to go ahead and start you on medication. And I said, no, we're not going to do that. Why would you lead with, we're going to put you on medication? Why would you not lead with, hey, look, you need to start changing what you're eating. You need to exercise more. You need to be more proactive with your health. And let's see if we can get your cholesterol down a little bit. That would be the way to go. But we don't do that. Why? Because those physicians are going to make money. One, the more times I go in, every time I go in, they get paid. And the more drugs they push, the more money they make from pushing the drugs. It is what it is. And if you don't believe that, you're in for a surprise, right? This is a sick care society, not a health care. And yeah, I talked about it a minute ago. The salaries for doctors and nurses, those play a big role. And some of these folks are making really big money. And I would like to say, because I have a little bit of background with medical, but I mean, I would like to say, look, these people deserve this. They went to school, they work hard, they deserve to be paid well. Being paid well is one thing. Pushing drugs, pushing sick care on people instead of preventative measures for their health, that is not. And, really, do some of these physicians need to make millions a year when they can live very comfortably on less and probably do their patients a lot more service by not pushing drugs and procedures on them? Something to think about. This is just something to think about. Try not to take a side, but you can read between my lines. Okay, so what does this boil down to? Well, we're overpriced on everything, right? So I'm going to give you an example. Everyday hospital items. Tissues, plastic urine bottles. I brought that up a minute ago. Gauze. Things that cost pennies at the store, right? Go to Walgreens. You can buy all of these things at Walgreens, CVS, any of those type of stores. And you can buy them for pennies on the dollar to what they're going to charge you at the hospital. Okay? Sometimes they're marked up hundreds, and I'm going to tell you this. Sometimes, this is the research I found, sometimes thousands. They're marked up thousands of percent at times. Now, why? Well, we talked about it a minute ago. It's because they can, because nobody's regulating them, and they can do it. And the insurance companies are paying it. It's just this big, gigantic mess, scam of insurance, doctors, healthcare providers. Because let's face it, I go to the doctor once a year. I don't even know who my doctor is. I've never seen my doctor. I see PAs. I see physician assistants. The doctor's not even there. They just have their name on the door for licensing. That's it. So I don't even get to see the real doctors, just the PAs. Not that they're not almost as good.
We get it, though. It's true.
So, all right. So that explains why it's expensive, right? Now you have a pretty good idea why it's expensive, but why are we getting denied coverage then? Right? If they know they can make all this money and the insurance companies are going to pay it and the hospitals are going to ask for it, then why, if they're already bringing in these enormous profits, why are we getting denied? And this is what I found. And boy, Cherie's going to be able to jump right in on this because I'm sure she went through this little circle. First, administrative errors. Oh, well, this I didn't get crossed, or a dot, and this T didn't get crossed, so we're going to start all over. And it just keeps you in this cycle of pretty soon you're just like you throw your hands up and go, okay, I quit, you win, right? Administrative errors. Using out-of-network providers, that's another one. Or not getting pre-authorization. Now, I want to share this with you. Don't go on WebMD. Don't self-diagnose yourself through Chat GPT or something, and then contact a provider that may be out of your network because you've self-diagnosed. That doesn't count. You have got to go. See, it's all about the money. You have to go to that primary. Okay. Now, sometimes it's insurance companies just simply decide, and this is where Cherie comes in. Well, it's just not medically necessary. Yeah, you just don't need it. Well, wait a minute. What do you mean? You're an insurance company. What do you mean I don't need it? If I have a doctor telling me I need it, a real physician that I'm going to have to put my trust in, And now you're saying, no, we don't think you need it. Because what, you have a check sheet? Everything didn't check? I don't know. So I wanted to see kind of, hey, how often does this happen? Because Cherie's going through this. She's going to talk about it here in a minute. And believe you me, she's going to tell you about it. But this is what I found. Every year, insurers process over 5 billion claims. That's a B for billion. And out of that, hundreds of millions are denied. In 2023 alone, the Kaiser Family Foundation, so you can look it up, found that 73 million out of 392 million in-network claims claims were denied. That's 19%. It's 20%. Let's round it out, right? That's 1 in 5. 20% were denied. Wow. Okay. And if you go out of network, that denial rate shoots up to 37%. That's phenomenal. That is, I can't even fathom those numbers. So people are being denied claims left and right. And I don't understand it. So if you've ever felt like you're banging your head up against the wall with an insurance company, and that's what she had to go through, you're not alone. Millions of Americans are banging their heads right along with you right now. So, well, listen, this is a really good time for us to, we've got the lay of the land, so let's dig in the dirt now. And I'm going to turn this over to Cherie, and we're going to let Cherie kind of explain to us what she had to go through. Go ahead. Tell us. Because
Thanks.
I know the story, and it's...
Yeah, it gets me pretty riled up too, and it is really frustrating. I work for this company, and they offer 3 different types of healthcare, so you choose one, right? Because what's the difference? You have a higher out-of-pocket or a lower out-of-pocket up front, so you just make a choice based on your living situations and how much it's going to cost per paycheck. So I do what I think is best for me in my life. I don't have any illnesses. I'm not sick, like you said. I don't really use insurance very often. And I went for the middle route because, well, can't be the worst, and you never know what's going to happen. And they were great at first, and I did call because after years of going through other insurance issues, I've learned that you have to call and you have to make sure that just because the website says they're in network, it might not be in network. Just
Right.
because they say this copay's X amount of dollars doesn't mean you're not going to get a bill later, because it happens all the time and it's really unfortunate. So it's just a tough situation in general. And then we talked about, the max out-of-pocket deductible. So before I got discounts on anything, before I could stop paying for my doctor visits, before I could get any discounts on my prescriptions, I had to hit a max out-of-pocket deductible of $6,000. And unfortunately, I'm not somebody that has a big savings account, and I don't have a whole lot of money. So $6,000 extra on top of all of the things that I had to do just to get to that point, And when you are dealing with something that involves literal life-changing opportunities, you do have to play this little song and dance with the insurance company. So I knew I would have to go to physical therapy first. I knew I would have to, see all these doctors and get x-rays and get MRIs. And that whole process in itself is tough and frustrating. I asked for an x-ray, and I actually still have never gotten that x-ray because every time I attempt to get one, somebody says no to me. Somebody pushes me back. Somebody says, oh, insurance didn't approve it, or, oh, we don't take your insurance anymore. So it's just this constant, ever-changing battle where you just can't always get the answers. And you call this company, and it's United Healthcare. I mean, we can be really honest about it. They, there's good and bad stories about them, right? We know about United Healthcare in the news. So it truly is the sludge where you call for a question and you get an answer and you expect that follow through, and then nothing ever comes about. I've called 5 times in the same day and had 5 separate answers, completely different answers and completely different information. Of course. I have one of the top neurosurgeons in the country as my personal doctor for literally a life-changing, medically necessary procedure, and insurance continues to deny it. And I had already hit my max out of pocket of $6,000 at that point when I was still being denied for this. And this is something that's ongoing. They have record of me for all the years that I've had insurance with them, seeing that I have been treated for, something revolving my back, and it's so frustrating to think that they get to dictate my life, that they get to put in notes and go into their interqual system that United Healthcare uses, and their algorithm says, oh, I see a keyword and I don't like it, so the answer is no. They never gave me a peer-to-peer review, which is absurd. And every time I call and try to do something, I give them the Arizona state law of urgent requests need to have a 72-hour review, and they get dismissed completely. I've called and asked to speak to a manager, and I've gotten the runaround on the phone, and they sent me to a line that just rang and rang and rang, and it was a blank voicemail, and I still have never gotten a call back from that. It's just so tough and so frustrating, especially when you have to then start advocating for yourself. And
that's big.
It's huge.
That's big.
It's so hard because we don't know this stuff. I mean, this isn't just common knowledge. We count on our insurance to be able to help us. They have people put in place, or so we think, in order to help us and help advocate for us. They shouldn't be making medical decisions that changes who they are.
Especially after, like in your case, you've got a surgeon, one of the top surgeons, that's saying this needs to be done. And now an insurance company saying, well, we checked our algorithm and we're not doing it. We're not covering you.
And it's frustrating because it really is just the algorithm. My denial letters they're kind of funny because when I read them, it really looks like they typed a keyword and it created a sentence. And so it's just all these jumbled sentences that don't really make any sense, but it's their denial for me, right? It's their reasons. And they
just keep you confused.
To keep you confused.
Keep you confused. Get you frustrated.
Yes.
Then you'll finally throw up your hands. And
that is exactly it. And that's exactly the situation that it was. Mm-hmm. My doctor's office said, hey, it's probably going to get denied because that's just the way insurance works. Got denied. I knew it was going to happen. We go for the next one, and they said, oh, by the way, you need to have a neuropsych evaluation. A 4-hour neuropsych evaluation. You want to waste my time? You want to waste another doctor's time just to make sure that I understand what this procedure is? What a waste of time and resources. Mm-hmm. I had to go into multiple other types of like a CT scan, a DEXA scan, all these MRIs, X-rays, all these things that needed to happen on top of I had to see, physical therapy, and I had to then try going to pain management and finding out, oh, do you want to take more medication and just pump you full of stuff, or do you want to try these injections, or what is it, And I don't want any of that. I don't want to put Band-Aids on this and prolong this even more, and it's just frustrating because you try so hard and I mean, I know I'm talking to humans on the other line, but they're not trained to be humans. They're trained to just say no or to get you off of the phone or
follow the checklist, follow that little checklist, right?
They can't veer off of it. They can't have an adult conversation with you because that's not their job. So there's no humanness to any of this. It's all transactional and it's all for profit. And the wildest thing I found out through one of my doctors during this process, because I have so many doctor's notes stating that this is a very medically necessary procedure and the reasons are very clear as to what this procedure would do and why it would benefit me versus all of some other options that United Healthcare seems to suggest, which again, they shouldn't be suggesting any medical care for me whatsoever. That's not their job to give medical advice.
Yeah, since when does the healthcare provider decide what procedures you need or don't need versus the surgeon who went to school, got trained on that? So truly they're following just a script, right? Mm-hmm. Unbelievable.
Yeah.
It's crazy. Guys, I want to jump in really quick because I want you to know a little bit about Cherie here. this is a girl that she's a health coach. She understands nutrition. I mentioned this. She works out. She exercises. She's a snowboarder. She's a mountain biker. She hikes. She climbs. She's an outdoors person. This situation that's occurring to her, and it involves her back, became debilitating. Debilitating to the point that there was no more exercising, no more mountain biking, no more snowboarding, no more even taking her dogs for a walk. It was debilitating. It was so bad that she had to go on FMLA and step aside from her work and basically go on short and long-term disabilities to try to survive as she tries to navigate through this spider web map of healthcare procedures. And she mentioned she has one of the top physicians in this field working with her, and still the insurance company is pushing back.
Yeah. Thanks for summing that up and bringing that into light. And it brings tears to my eyes because I feel like there is red tape on my name or a red flag on my name when I call into the insurance company. I feel like
because you know me.
Their job is truly just to deny and make my job harder or my life harder. And what I don't understand is that they get to dictate that. It doesn't make sense to me. It's so hard to even talk about because I am such a positive person, but the pain was so debilitating that could I even live life anymore? And to think that it's because of some flawed algorithm that's set up so unhuman, creating these decisions for us, and they have no idea what I'm truly going through or what I'm capable of.
Correct. So it's interesting. So I'm gonna cut a little bit ahead now because Cherie's gone through appeals. She's gone through denial. She's gone through appeal. She's gone through denial. Finally, I think the insurance companies are like, you know what? We're done. United Healthcare is like, I'm sorry, you're on your own, which pushed it to she legit was on her own and had to come up with the money herself for a surgery center to pay for the physicians involved, anesthesiologist, all of the things that go into doing a procedure on your back came out of her pocket. Her insurance company has not helped her in any way, shape, or form on this. And something interesting that I want Cherie to talk about is she approached the surgery center saying, look, here I am. I'm a young woman. I'm a healthy young woman, but I have this problem. I need this surgery. The healthcare company has denied it multiple times. I've tried everything and appealed, even went to the state board of insurance board. Can we do a cash pay? I'm going to turn this over to Cherie.
Yeah. So super frustrating.
Cash pay. She's offering to pay them cash.
The surgery center would not talk to me about a cash pay. They would not give me an answer whatsoever. They said that it would breach their contract with United Healthcare. So again, where does this put me? Where does this leave me? I need this surgery in order to live a fulfilled life. And the surgery center wasn't even going to offer it for me. So I did finally get a cash pay quote the night before my surgery. So I didn't even know what I needed. And again, remember, I don't have savings. Like, this isn't something that I can just go ahead and pay out, you know? So this took a lot of courage to even continue this route going a cash pay. And as you mentioned, I did get the Department of Insurance involved with Arizona. I have not finished filing my final appeal yet, though, so I just wanted to clarify that. I still
get them, Cherie, get them.
I know. I'm going to submit several different claims against them, against United Healthcare, and I'm going to be submitting a final appeal through independent review with the Department of Insurance. The problem with that and why I haven't done it yet, why I'm still kind of waiting me is I just want as much information as possible, because this independent review will not talk to anybody, any doctor, anybody. They make their own decision. And we have to remember who these people are, who the people making these decisions, these physicians that are sitting behind the paper and behind the desk making these decisions, they're not active surgeons. They're not active in those fields. Why are they sitting there pushing the papers? So where does my health lie anyway? Like, you know what it truly is in my hands right now. And it's just, it's so unfortunate, because I know for a fact that I'm not the only one, obviously, that this happens to. This is constant, and they hope that you don't push back. They hope that you don't fight and that you don't ask questions. And I just need to let everybody know that I think there's a few things that you really need to consider, and that's making sure that you track everything. You list every single document of every phone call that you make, of every letter that you receive, of every doctor that you visit, and you have to advocate for yourself, and I am here to help with anything that I possibly can.
Keep your records, right. So look, we're pushing our normal 30-minute number here that we like to keep our podcasts at, but it's okay. I think it's worth it to go a little beyond. There's a couple things I want to just quickly share with you. And Cherie, thank you so much for this is so emotional and so personal, and for you to be willing to get out like this and talk about it is really, it really shows a lot, and it really shows your character, and I appreciate it. So how do you get around this, right? I mean, right now, as we're recording this, it's November, even though this episode won't air till later. It's open enrollment time. And so everybody's trying to figure out, what are they going to do? Where do I go? Do I go to the Affordable Health Care Act? Do I jump into the marketplace and see what's there? Let me tell you, this is if you know anything about why our government is in a shutdown right now, it's because there is a division between the two sides. And one side is saying, we're not going to fund the government until the other side agrees to work on the Affordable Health Care Act, provide coverage and this and that, because right now as we speak, healthcare coverage is going through the roof, folks. It's going through the roof. For me, my wife and we're looking at about right around $14,000 a year for healthcare, and we each go once a year for our annual physicals. I was talking to my niece. Luckily, I was still on City of Chandler, so I still have that big city pillow, I guess, to fall back on. I was talking to my niece, who does not have that type of coverage. Theirs was around $22,000 annual, and that's just for a husband and wife, healthy, strong couple. So it's getting out of hand. And you might join the Affordable Health Care Act. You might go in the marketplace and go, hey, look, I found me coverage based on my income and all of this other stuff. I can get coverage for $500 a month or $800 a month or whatever. Take a good look at that coverage, because like Cherie just said, you're liable to get that $6,000 that you got to pay out of pocket before they'll even start covering you. So know your health care, know your coverage, talk to people that are professionals in that field, and get good information. All right. Now, I don't know. I know some people, I've got some friends that are kind of the pay as you go, and it kind of works for them. And I've actually thought about it, but I'm like Cherie. I mean, I like to go outside and do crazy things, and so it's not uncommon for me to get hurt. So I better keep my insurance. I don't think I can pay as I go. But do what you have to do to save money. Do what you have to do to get proper coverage so that you are covered in the event of something catastrophic, because I don't know what to tell you. It can ruin you. It's put so many people into bankruptcy. So the step one is this. I can't stress this enough. Stress one is this: be healthy, eat well, stay active, lower your stress, right? And surround yourself with love and the people that love you, and loved ones and friends and family. and lower that stress and be healthy. And that's going to keep you out of this situations or these type of situations. Now, one last thing, Cherie did have to pay out of pocket. And some very, very wonderful, kind people set up a GoFundMe account for her. So, Cherie, can you tell us a little bit about that really quick?
The most humbling experience of my life, that's for sure. But yes, I did have some incredibly generous people in my life that donated significantly to help me in order to pay as much of this out of pocket as I could without having to dive into my credit cards. And my brother really helped me out as well with a no interest loan, but I wouldn't have been able to do any of this.
If anybody wants to help you, how do they do that?
Well, again, very humbling. So there is a GoFundMe account under Cherie Favazzo, and I can certainly get links to put up. Certainly Venmo and Zelle are options as well. And, everything helps tremendously, and it's just so appreciated. And I'm not going to stop fighting. I mean, I have to. It's the principle now. It's bigger than just me and my back and getting my life back. It's bigger than me.
That's awesome, Cherie. Cherie, you've been very courageous. You've been very strong. I'm super proud of you, and that's not just coming from your dad. That's just I'm telling you to go through what you've gone through, and still hold your head up and still smile. I'm really proud of you, and that's a big thing. So you should be proud of yourself. So here we go, folks. I'm going to wrap it up. We've gone past the 30. I'm sorry, but it was really important, and I think it was important to hear what Cherie had to say and understand. I mean, this type of situation is very stressful, and it's very taxing on your health, even though you're trying to fix your health. But the stress involved and everything that goes with it, and the frustrations, I don't know. I'm lucky it wasn't me, because I don't know how I'd handle it, because it's so stressful. Okay. Anyway, we wanted to share this valuable information with you. We wanted to ask some important questions. We wanted to give you some facts, give you some stuff to chew on a little bit about our healthcare system. And we want you to make your own decisions. We're not here to tell you what to do, but we can give you some information, and hopefully it'll help you. So as always, my friends, stay curious, because staying curious and asking questions, it helps us learn. It helps us be better understanders and better people. Fact check. I'm telling you, even what you heard on my podcast today, fact check me. You have to fact check and make sure that the information that you're getting is valid. And above all, be kind to one another. Just take care of each other. It's so important. Okay, we'll see you next time on Joe's Hot Takes 25. And be well.